Good morning, Dr. Ward. Would you like to do a mic check this morning?
Hello, this is Dr. Ward. Can you hear me?
Good morning, Dr. Ward.
Thank you.
I want to let you know that we started recording. We are ready when you are.
Thank you, everyone. I see that we have 214 attendees this morning. It is 11:04, and this is when we customarily begin our call. I'm going to start my video in case you'd like to see me this morning. I wish I could see all of you. We have 225 folks here now, and I'm going to go ahead and get us started. Good morning. Today is June 17th, 2020. This is our 10th in a series of calls for Medicaid behavioral health providers that seek to provide verbal updates on our response to the COVID-19 state of emergency and associated guidance. My name is Dr. Alyssa Ward. I'm the Behavioral Health Clinical Director at the Virginia Department of Medical Assistance Services. We appreciate you being here with us today for this WebEx event, and due to the large number of participants, double checking that number, 242, we will be muting everyone except for our panelists on the call today. And as we have moved to this in the last few weeks, we will not be answering questions live about service flexibilities or Medicaid policies in the Q&A function. We have noted that it is tricky to multitask while we are delivering this content and be able to keep up with our agenda and answer all of your questions. We want to assure that we attend to any questions that you may have and give them our full attention and our most accurate and robust response. So we encourage you, if you have those questions, to submit them to the email boxes provided on your screen right now. That is enhanced BH, as in behavioral health, at dmas.virginia.gov, and SUD at dmas.virginia.gov. Please note that there, I believe, Laura, can you confirm that the chat box is functional, or we actually have used the Q&A box this week, is that right?
Correct. So Q&A is functional and chat is not.
As we have moved forward with our competency in WebEx throughout the COVID response, we have found that the Q&A box is a better function because we can respond directly to you. So if you are having technical issues or things of that matter, you can type them into the Q&A, and we will make sure that we are seeing if anyone is reporting issues with voice or sound quality or having particular issues accessing things. So next slide. This is our agenda today. I'm going to get us started, and then I will be in good company today with Dr. Cleopatra Booker, who will be providing global updates by Jason Lowe, who is our Support Act Grant Coordinator, who will go over some available resources. And then actually we have a little bit of a change today. Dr. Booker will also be going over the frequently asked questions, and then I will close us out at the end of the call. Next slide. So we are now 14 weeks into the state of crisis related to the COVID-19 pandemic. And as we acknowledged in our last call together, the crisis has really laid bare long-standing and widespread racial health inequities that exist in our communities, in our state, and in our nation. And as the crisis evolves and our understanding of its precipitants and its impacts grows, it's clear to all of us in this behavioral health system that we have a shared opportunity and responsibility to address these health disparities and to continue to work together to improve our system for those made vulnerable to COVID-19 and to behavioral health challenges through a long history of injustice and trauma. We're grateful for the collaboration of everyone over the last 3 months, and there's clearly tremendous work that lies ahead. So here at DMAS, we are tackling that work hour by hour, day by day, week by week, and we know you are too out in the field. We may not have all the answers at once. I was just on a call with the Provider Association prior to this call, and there were some really excellent and timely questions being asked about racial equity. And I'm glad people are asking those questions. Our systems don't have all the answers right now, but that isn't to discourage you from asking the questions as we look for the answers together and we figure out that path forward together. We are committed to that path and to finding the next right thing with your partnership. We're aware that many of you have questions about reopening guidance and when DMAS is going to begin to allow face-to-face group service delivery. We're going to speak a little bit to that on our frequently asked questions today. We are working fervently on operationalizing kind of the unwinding of the process of COVID flexibilities this week, and we anticipate that a formal memo about the allowance of group services is coming soon. At this time, we're also working with DBHDS to contribute to the development of some guidance to help with reopening as you all make decisions about how you may resume group-based services for behavioral health or more face-to-face services in general, if that is your prerogative. But we want to really underscore here today that we plan to continue the waiver of face-to-face requirements. So simply because we are going to move forward in alignment with the governor's reopening plan does not mean that at this time we are taking away the waiver of face-to-face requirement or the telehealth capacities and flexibilities that you are operating under at this time. So this is more so we are moving towards alignment and opportunity to do face-to-face, should that be member preference or allow for better access to services. But we are aware of the tight bind that all of you are in as you try to make those ethical decisions about weighing vulnerability and risk, both for your staff and your members, and as we move back into more face-to-face contact. So we have several global resources to share on this call that I'll go over pretty quickly. One of those is a reminder, which is on your screen now, of where our provider call recordings are located. They are uploaded to YouTube, and the links are provided on our website on the emergency waiver kind of COVID section of the website. You can go to the next slide. Likewise, our frequently asked questions documents that we do update as the questions evolve and we have clarifications to our memos. We put those in the frequently asked questions and load them up there. Next slide. We also are excited to announce today that we have a follow-up to our initial telehealth survey that we conducted very early in the COVID crisis. This is a little bit of a more detailed survey. It is not a mandated survey, but we really hope that providers will take the opportunity to let us know what you and our members' experiences have been of telehealth and your work with them. So the link is provided here. We will also be sending this out, obviously, following the call, but we also have a fancy QR code here. So you could actually scan it right now and work on that survey while you're on the call. These slides will also be sent out, and so you could scan that QR code from your phone right off the screen of your computer if that is easiest for you. Next slide. Oh, and just a reminder that that survey will be open through July 2nd. We also want to remind you that it is Post-Traumatic Stress Awareness Month, and like last week, there are a number of available resources out there that are, very salient right now around trauma. One such resource is the National Center for PTSD through the Veterans Association. And there is a link here provided, and there are some good resources for managing stress during COVID-19 that are available through that center. Next slide. Likewise, they have a lecture series that is ongoing the third Wednesday of every month that is free of cost and free continuing ed credits. And you can sign up for notifications at the Center for PTSD's site. Next slide. We also want to note that we have uploaded a adapted resource. Early on in COVID, we posted a general resource sheet about coping in the time of COVID, and we have been working on adapting and updating that to add in specific resources for both members and providers specific to traumatic stress, community violence, and then in particular, historical and race-based trauma. This is simply a listing of resources that we have vetted and found to be high quality. And so it is there just for you as a resource, and it is uploaded onto our site. Next slide. We also are aware that many of our licensed providers in Virginia use PESI as a resource for continuing education credit. And PESI has 2 free panel discussions that are posted on their site about racial injustice and trauma and how mental health professionals can respond. And so just putting that out there for folks as a resource. Next slide. And this is a number of different resources that were included on our resource list that we hope that you all may find helpful. That they're simply there as resources and suggestions, but of course not mandatory trainings. Next slide. I'm going to hand the mic over to Dr. Cleopatra Booker, who will be talking about global updates at this time.
Good morning, everyone. Today you can see me as well. Wish I could see everybody else too soon and very soon. We will all be seeing each other, hopefully. All right, so here are some global updates. Emergency payments for Medicaid providers. There's been a notification sent out to every provider. You have not received that notification. There is Medicaid providers now have the opportunity to receive coronavirus relief funds to support them during the COVID-19 emergency. The U.S. Department of Health and Human Services is going to allocate about $15 billion to providers who participate in Medicaid and CHIP and have not received a payment from the Provider Relief Fund general allocation. The applications for submission to receive this payment is July 20th, 2020. So make sure you get that information in by that deadline. There is also a website for you to go to that discusses the application process, the type of data that you will have to be required to submit with that application. And once again, just a reminder that the applications are due by July 20th of 2020. Next slide. As Dr. Ward mentioned earlier, we are preparing to issue reopening guidance. The way that we are going about preparation for reopening that guidance is through the principles of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. The principle by agencies and decision makers in these discussions. We're establishing teams that are dedicated to promote equity and recovery, and we are proactively identifying gaps in the need for additional policy level supports. as well as investigating and strengthening of the healthcare and infrastructure to foster resilience and recovery. Next slide. The current plans of action that we're going about in regards to issuing reopening guidance. We're working collaboratively with multiple state agencies to develop reopening guidance and analyzing what the data is telling us so that we can make the best possible policy decisions and decisions moving forward. We are reminding providers that if you want to continue using telehealth services, please make sure that you review the 2014 telehealth memo. Start preparing to use place of service O2 and modifiers GT. The exact date of when these modifiers and place of service will be required is not determined yet. But if you look at that 2014 telehealth memo, it will help get you a jump start on how you should be configuring your systems and getting ready to build with those modifiers and place of service O2. As mentioned earlier, DMAS is now conducting a Part 2 telehealth survey. So we want to gather providers' feedback. It's very important that we get as much provider participation as possible. This survey will help us move forward in figuring out how we should be redesigning the system, because at this point it is somewhat of a redesign to make sure that we are using telehealth and some of the other flexibilities appropriately as we move forward. DMAS is working across the DMV to discuss ongoing telehealth allowances and licensure reciprocity allowances. We are part of a DMV collaborative work group that consists of providers as well as other state agencies from DC, Maryland, and Virginia. DC is working with consultants to monitor state and federal, DMAS is working with consultants to monitor state and federal level authorities for us to react and provide guidance appropriately. And we've developed a behavioral health PPE fact sheet for providers to go to and use. Next slide, please. We want to remind everyone that Executive Order 51 and the provider flexibilities was amended. And so none of the current flexibilities that were set to expire on June 10th expired. Right now, we will be giving more guidance as needed when provider flexibilities do change, but providers should continue to maintain and shall continue to maintain the directives and the flexibilities that has been given thus far. Next slide. Speaking of issuing any new guidance or flexibilities, we did issue a memo on June 11th, specifically for behavioral therapy providers. That memo is located on our website, so if you did not receive a copy of that memo, you could go to our website and retrieve that memo. The June 11th memo revised the previous guidance and now reflects that when billing for behavioral therapy, providers shall refer to the behavioral therapy services reimbursement table. That is on page 23 within the DMAS manual, where one service unit equals 15 minutes for this level of care. Basically, this memo is saying that behavioral therapy providers do not have a 1 unit max limit per day for audio only communications. They are able to actually bill at the 15-minute unit increments for audio only communications. Next slide, please. We are fully aware that the Virginia Public Health Commissioner has issued guidance for the reopening of schools, and that we understand that the schools must submit plans to Department of Education prior to them reopening. This directly impacts our therapeutic day treatment services, which are very important to the school programs, especially summer programs. At this time, we are working on draft communications to assist more with the TDT providers that are interested in partnering with their schools to open up the school summer programs. We are strongly encouraging you that even though you may not have official guidance from DMAS or any other state agency, you should be working with your school and your district to make sure that you are a part of that phased reopening plan, to make sure that the plans that you are creating to incorporate your services within that school align with the plans that they will be submitting to Department of Education. And if you decide to partner with the school to provide services within a school for TDT, you should be operating within the approved scope of the plan that has been approved by Department of Education. I want to stress that again, that if you are a TDT provider that plans on operating within a school, you should be working with each school and district now to make sure that you understand what will be their plan of action. And when you start to function within the schools, you need to assure that you are functioning within the approved plan that they have from the Department of Education. Each school and each district may have different approved plans. And so that's why we are stressing that you partner with the schools to make sure that you are aligned with their plans to reopen. Next slide. This is a reminder that psychiatric residential treatment facilities must submit to Magellan a signed letter of attestation from their CEO of the facility stating that the facility is in compliance with the federal condition of participation for the use of restraint or seclusion in psychiatric residential treatment facilities. This is due to Magellan on or before July 1st, 2020 by 5 p.m. Providers must submit their attestation letters to the Magellan number or via email. This is a requirement per the provider agreement. If the attestation letters are not received, approval for new authorizations will not occur. Therefore, it is very important that you submit the information to Magellan by July 1st, 2020. Next slide. I am now going to turn this over to Jason Lowe to go over our resources.
Dr. Booker, thank you very much. Good morning, everyone. First, I want to apologize for Anna Shalley not being able to attend today. She was otherwise engaged, and I am standing in for her to present this important information this morning. So she apologizes for not being able to be here today. Next slide. We first want to talk about a behavioral health personal protective equipment fact sheet that is available online. DMAS is sharing these resources to help continue to protect our community. It's essential that behavioral health care providers and facilities implement plans to protect patients and staff from infection to the greatest extent possible. The information offered on this fact sheet is aimed at decreasing the likelihood of infection and viral transmission and providing for behavioral health needs of patients. We encourage providers to continue evidence-based practices and best standards of care for all services. Because of the substantial risk of coronavirus spread with congregation of individuals in a limited space, such as an inpatient or residential facility, SAMHSA is advising outpatient treatment options when clinically appropriate should be used to the greatest extent possible. DMAS is recommending outpatient treatment services be utilized wherever possible, as well as telehealth. Comprehensive long-term residential treatment programs where COVID-related precautions can be implemented remain a viable treatment option when clinically indicated. Next slide, please. Here are some other links concerning PPE that you could visit if you need more information or resources. There's a number of links from Centers for Disease Control and Prevention concerning hand washing, protecting yourselves and others, face coverings, as well as caring for individuals sick at home. It's also a helpful tips page from the Virginia Department of Health and information about an OSHA training that providers can use as well. Next slide, please. The CDC also has available a number of print resources as buildings are beginning to be reopened, as well as facilities and offices. Providers should deliver and close clear communication and signage concerning social distancing and hand washing techniques and other risk mitigation strategies to fight against the spread of COVID-19. The print-only materials are developed to support COVID-19 recommendations, and they are available on the CDC website to be printed and posted at your facilities and locations. Next slide, please. We want to take a minute now to pause and recognize the celebration of Juneteenth this year. As most of you are aware, yesterday, Governor Orphan declared the 19th day of June this year, also known as Juneteenth, to be recognized as a holiday within the Commonwealth, and ordered that all executive branch state offices will be closed. Juneteenth is the oldest national celebrated commemoration of the ending of slavery in the United States of America. And why do we celebrate this important holiday on June 19th? It dates back to June 19, 1865. And this is the day that Union soldiers, who were led by Major General Gordon Granger, landed at Galveston, Texas. Texas was the last former Confederate last Confederate state to abolish slavery. And Major General Granger and his men landed with the news that the war had ended and that the enslaved had been freed. The Commonwealth of Virginia is celebrating Juneteenth to recognize the important roles and many contributions that African Americans have made to our Commonwealth and our nation as a whole. In order to celebrate this important holiday, DMAS offices will be closed on Friday, June 19th. All DMAS technical assistance webinars will be canceled or rescheduled. And as Governor Orphan stated in his announcement yesterday, awareness and education are critical to our path forward together. And towards this end, DMAS would like to encourage those who are planning to participate in our webinars to consider using this time to learn more about Juneteenth and its importance and special significance for all Americans, but of course, especially our African American brothers and sisters. Next slide, please. As noted, our technical assistance offerings for Friday have been canceled or postponed in order for us to all be able to celebrate the Juneteenth holiday. We will resume our Q&A sessions with Paul Brassler and Dr. Mishka Turplin next Friday as regularly scheduled. The individual therapy session that was scheduled to be presented by Mr. Brassler on Friday afternoon will be rescheduled for July. Next slide, please. All of our other webinar offerings that you see there are able to review on our Support Act Grant section of the ARTS website on the DMAS webpage. This is accessible through www.dmas.virginia.gov/pound/arts. If you scroll down to the Support Act Grant section, you'll see a link to a PDF for all of our June webinar offerings. This PDF will provide you all of the information that you need to access our training events, including dates, times, presenters, topics, and links where you can register for and attend our events. We've also recently added slide decks for all of Mr. Brassler's presentations to the Support Act section of the ARTS website. We have also added slide decks for all of our monthly stakeholder group meetings. We will soon be adding a resource slide deck that includes some of the information presented here, as well as other information that pertains directly to the Support Act grant, as well as slide decks for presentations provided by Dr. Mishka Turplin, our addiction medicine specialist. Next slide, please. As a reminder, we always want to note the importance of accessing naloxone and training on administration of this medication, especially during this time where community access to this naloxone may have been disrupted. You can get trained on the administration of naloxone through the State Department of Behavioral Health and Developmental Services website. We offer trainings Wednesday morning. You can also access on-demand training on naloxone administration at getnaloxonenow.org, where you can enter your zip code and learn more about training opportunities available that you can access at your convenience. Medicaid does provide naloxone to members at no cost and without prior authorization. Members are encouraged to call their local pharmacy before going to pick up the medication. Not all pharmacies regularly stock naloxone. Virginia residents can also obtain naloxone through the mail from the Chris Atwood Foundation. You can use the link on your screen there that will be included in the slide deck to have naloxone mailed to you from the Chris Atwood Foundation. We appreciate their hard work in doing that. Next slide. Last thing I'll mention is our ongoing Project ECHO buprenorphine waiver training session opportunities. We're providing these in collaboration with the Virginia Department of Health and the American Society of Addiction Medicine. Buprenorphine waiver trainings are for physicians, nurse practitioners, and physician assistants, interested in seeking their waiver to prescribe buprenorphine for treating opioid use disorders. The online session that is available delivers the required live portion of the total training hours. And we have 3 sessions coming up, one later in June, and then one in late July and late August. These trainings are provided at no charge. Next slide, please. And with that, I will turn it back over to Dr. Booker to discuss our frequently asked questions. Dr. Booker.
Thanks, Jason, and great job presenting. All right. So, next questions. I believe there are 2 questions, but detailed questions this week. Question 1 out of 1. When will providers be able to resume having groups in outpatient office-based settings since the state is in phase 2? In accordance with the memos and the guidance that has been released thus far, DMAS is not allowing outpatient office-based groups to occur. Virginia is moving into different phases by region, sometimes cities and counties. So we're striving to be consistent and make effective and safe reopening decisions aligning with the governor's reopening strategy. Time DMAS does not have a date of when groups will be allowed to return back to office-based settings. We will post any guidance with a date forthcoming. We are not being hasty with making these decisions because this impact more than behavioral health and arts providers. So we're trying to coordinate across services. We understand that other businesses are opening soon. However, office-based group therapy that occurs within an IOP program or PHP, TDT, or PSR is not the same as a restaurant, a gym, or store. Within group therapy programs, the individuals may be in the same areas for multiple hours at a time, sometimes 5 hours at the same time, whereas in a restaurant or a gym or store, you're not typically in there for hours at a time, so the ventilation is not the same. Additionally, within groups, especially mental health groups and substance abuse groups, where we're talking about very challenging discussions, there is additional bodily fluids because of tears or people perspiring as they sweat and get anxious and things like that. So we're trying to take extra precautions in making sure that any guidance we issue regarding having groups is in the best interest of our members as well as providers. I do see a question that I can answer at this point. Someone asked, can group therapy occur via telehealth? We strongly encourage if you can utilize telehealth and if it is in the best interest of the client and it is clinically appropriate, you can utilize telehealth for group therapy. In regards to groups continuing this response, we are also aware that due to recent social gatherings and protests being observed across the country, there is a possibility that we may see a rise in cases. Fortunately, right now in Virginia, that is not occurring, but we are still watching very closely. However, for these reasons and for many more reasons, we once again do not want to be hasty in relaxing our decisions of flexibility and around the guidance that we've issued. We are working very closely with other state partners to make sure that our reopening guidance is aligned and in the best interest of all parties. Please note that providers are able to offer groups via telehealth, and you are able to do one-to-one face sessions, but providers are still not able to do in-person group sessions. For example, if a PHP or IOP program wants to do a program consisting of virtual sessions for group and then one-to-one face-to-face sessions for therapy, care coordination, skill building, and medication management, that is acceptable and permissible. Next slide. All right, the next slide is the last FAQ that we are going to be going over. It has to do with, can I provide PSR to a group of individuals living in an assisted living facility? The response is, assisted living facility providers who are also PSR service providers may use appropriately credentialed staff to provide a service to a group of individuals living in the same facility, as long as they are following CDC and DSS social distancing guidelines for assisted living facilities, and any guidance for groups issued by DBHDS. Staff entering the facility should be screened appropriately, and they should be wearing personal protective equipment as appropriate. Please note that it is not allowed for assisted living facilities to be combining individuals. So it should be just individuals that are already living in that space attending a group. Next slide. And at this time, it is 11:38, so we do have a little bit of time. I will be joined by Dr. Ward to assist with answering any potential Q&A questions that we see that are able to answer at this time. If you do not get a response to your question, please make sure that you email those questions to enhancedbh@dmas.virginia.gov. If there are art-specific questions, could you please email those questions to sgb@dmas.virginia.gov. We will only be able to answer questions at this time that guidance has already been issued. If there are any new questions, we will not be able to answer those questions at this time. I do see one question that says, is DMAS suggesting that providers work with the county school systems to ensure that TDT is part of the plan, or is this a mandate? We are strongly suggesting that if you plan to be operating within a school and you have a contract with the school already to offer summer programs or school-based services, you should be working with that school that you've contracted with or that district to make sure that your operating plans, your plan to reopen within the school, are aligned with how they will be functioning as well.
This is Dr. Ward. I'm going to jump off of what Dr. Booker said to go back to that word mandate and to remind you all that DOE has released guidance, 137 pages of guidance to schools in making their decisions. Many of you may be aware that the school districts are developing their own plans that have to be approved by the DOE. So, DMAS is not a licensing body, and DMAS cannot mandate things around like the operation and kind of standard operating procedures for being in these facilities as your contract permits. What we are saying is we're just suggesting and trying to be transparent in our communication that if you are contracted with a school and you're in their facility, they are going to have a health and safety plan very, very specific to their school population, to their resources, to how they are going to allow kids back into that school. So if you have interest in operating in the school and working through that contract, we're just simply saying that it's really less about us and more about your relationship with the school to figure out what is even going to be possible. And that is likely to evolve. Schools are going to submit their plans, right? But we will also be subject to what happens to the virus in the intervening time period between now and the fall. So schools are doing their best to develop plans with many of them doing surveys to their communities to figure out what families are willing and interested to participate in. So this is going to be very tricky for everyone involved, and we're simply encouraging you to be in communication with your school contacts now to begin to wade through that with them and think about what may be possible. I see another question clarifying, so groups are not allowed, meaning DMAS will not cover in-person groups, from Patricia Schneeman. And just to clarify, Patricia, from the beginning in our initial call and our initial memos, we put out guidance or, a formal memo saying that we were not reimbursing for face-to-face group services, that all of those services could be offered through telehealth or telephone. There were a lot of different options, but no, we have not been reimbursing for in-person groups since the start of COVID. And what we're saying today is that we are going to be beginning to allow that. We're working towards that unwinding and a memo to be released to allow it. But we are also not the body that would typically issue, again, operational guidance about things like PPE or distance or ratios. And so we're working with our HHR partners on the guidance that they will be issuing that you all can use to inform your decisions. There are a lot of, go ahead, Cleo.
I was going to say the next question to be addressed. It says the Medicaid money that is being offered just for nonprofits or private practices as well. It is for Medicaid providers and CHIP providers. There is not a differentiation between if you are a nonprofit or a private practice. And that is the money that the individual is questioning is the coronavirus provider relief fund that is now open to Medicaid providers and CHIP providers. The application is due July 20th of 2020.
There's a question from Joseph Getch about the inclusion of in-person groups for PSR within ALFs, meaning services can be provided but not reimbursed. And I mean, technically, again, DMAS is not a licensing body, and licensing did not put out any restrictions on the provision of those services, but we did put out a restriction on reimbursement for face-to-face group-based services at the start of COVID out of an abundance of protection for our members. But again, we are looking to unwind those things very soon.
Just a reminder that the behavioral therapy memo that went out on June 11th is just for providers of behavioral therapy. That it is the CMHRS code of H2033 that is only applicable to behavioral therapy providers in regards to releasing that one unit per day max for telephonic only.
I do see an additional question, a detailed question from Barbie Kibler about your CSB. If your CSB removed the initial Medicare payment, does that make you ineligible for the new Medicaid emergency funding? We can answer that today, and just to know that, you know, these are federal programs, and we would refer you to the resources that were cited in the call to see more information about them. And April Gidgets, sorry, I don't know if I'm pronouncing your name correctly, and I apologize that I can't talk to you and get a correct pronunciation, is asking about the restrictions regarding face-to-face in the FAQs. What document is Alyssa Ward referring to? I'm referring to the behavioral health memo that was released at the beginning of COVID. There's a series of memos. They're all on our website. They were also sent via blast to all Medicaid providers. We've gone over them first every week and now every other week over the last month on these calls. So those are public facing documents that were released through Memo Blast and put on our website.
In regards to the provider flexibilities and directives and guidance, how long will they last? There is a question in regards to, will they last until the emergency is lifted, or will they continue post-emergency? Currently, they will last until the emergency is lifted, or we received an amended executive order. If there are any changes within the provider flexibilities or allowances, there will be official memos released by DMAS. So you will be fully aware of those changes. Will they continue post-emergency? We are currently evaluating what is appropriate to continue post-emergency, which is why I want to re-emphasize the Telehealth Survey Part 2 that we have generated, that we strongly would like for all providers to complete that survey. That will be helping inform our decisions around telehealth. making sure that we put in future policies and practices appropriate measures to continue those practices or flexibilities or discontinue as appropriate. So we are evaluating which flexibilities will be moving forward.
I think that we have come to the end of our questions for today. And so we are going to sign off for now. We appreciate all of your participation. Again, these slides are sent out following the call, and then they are subsequently posted, usually by the end of the week, to our website at DMAS. Someone is asking for a redisplay the slide on the notification required to be made to Magellan by residential treatment service providers. We can put that back up. That was also sent. It's not really COVID related, but we thought there's so much going on in the world right now that we thought that we would put that out as a reminder to you all as this annual process is upon us. And Magellan had sent out an email blasting that information to its providers. So you should have also, or someone at your provider agency should have received that information over email. But again, if you did not, you could contact Magellan through the Virginia Provider Questions email.
Dr. Ward, this is Laura.
Yeah.
I just wanted to let everybody know that it seems the slide deck from our previous stakeholder provider call 2 weeks ago did not make it to the website. So I just wanted to let everybody know that I am working on getting it up.
Thank you, Laura. It is, as you all have noticed, DMAS has worked really hard to be putting a remarkable amount of things onto our website that prior to a state of crisis, our website was not evolving in this manner or having this level of daily and weekly integration with new information like this. So we are really appreciative to our internal team at DMAS who's working extra hard to use our website as a means that we have simply our best to get things up there as quickly as we can with the resources that we have at this time. So thank you everyone for joining the call today. Thank you for your continued participation in this call and our conversations. Thank you for all the work that you do in service to our members. And please continue to stay well and stay safe. And we look forward to speaking with you again in 2 weeks.